Good afternoon. I want you to look around at your table, at the people. Most tables had 8 chairs. Some people are at the restroom. But think about this. Half of the people in this room will be diagnosed with cardiovascular disease, if statistics are right. A third of us, before we die, will be diagnosed with a cancer. Yeah, Darth Vader's here, right? The funny thing is if I ask everyone who's affected by one of those 2 diseases in your family to stand, every one of you would stand. Every single one of you. For cancer patients, of the 3 most common reasons they visit the emergency room, 2 are completely preventable: dehydration and nausea. We now have the largest healthcare epidemic ever happening in our country, and it's called opiate use. In fact, opiate use will likely eclipse the challenges of managing diabetes and hypertension. In many workforces, it already has. This past week, I was doing analysis for a very large national retailer. Almost 10% of their workforce has taken more than 6 opiate prescriptions in the past 12 months. They have a problem. Now, all this is going on, and Tom's chart caught my eye, because if you look at the amount of savings created for an employer from care management, case management, and disease management, it was less than 0.5%. And I'm here to tell you why. Imagine this most famous dinosaur of all in healthcare. I'm about to describe him. It operates Monday to Friday, 8 to 5. It has nurses in cubes on phones, rummaging through claims, trying to find who they might help. Quite often, they start looking when you've spent at least $10,000. Who does this anymore? Healthcare has changed dramatically over the last 15 to 20 years, and that model of care support was invented in the early 80s and is mostly used out there today. Yet the workforce is a 24/7 workforce. A couple of other things to get you thinking about this. 20% of the workforce, of the people working in the company, are family caregivers, and they are spending on average about 1,500 hours a year caring for a sick family member and trying to hold down a job, and 70% of them are women. Yet there isn't a single care management firm out there known for caring for a caregiver, only the patient. So let's talk about opportunities and change and what can happen in this space. 4 key trends I'd like to share with you in care management that I think are phenomenally disruptive with an opportunity to shake up cost. The first is this convergence of giant trend around care management. The fusion of value, this growing health economy where all kinds of services, not just hospital, physician, and pharma. The government is an influencer, and technology overall, where we're expecting to be able to see 24/7 how folks are doing. This convergence is creating a giant new opportunity in care support. And it has to happen when the bad stuff happens, at nights and on the weekend. If you've ever hung around an emergency room, you know it starts getting busy about 7 at night. Most people in America have access to reasonable health care support during the day. All the crazy stuff happens after hours. It's one of the most important changes we must make in care management is make it 24/7. The second is there's this convergence of where people get health care. The largest growing segment of primary care is now an urgent care center or a retail clinic. In fact, the neighboring state to here, Blue Cross of Arizona, over half their population gets primary care from an urgent care center. Half. Now, the challenge with that is that the stickiness of a physician relationship is gone. If you are going to an urgent care, every time you need something, you're likely seeing someone different each time. Care management, 2020 style care management, is the new concierge support person for the individual because there isn't enough physicians to simply do the job. Third is there's this growing overlap, and if you look at the data trends out there, a growing overlap between the provider and the care manager. Medicare began this journey about 4 years ago, fusing reasons for oncologists, cardiologists, orthopedic surgeons, all to actually start doing care support around their office. Now, most physicians, let's be honest, aren't prepared with technology nor staff to do it very well right now. But we are moving to a marketplace where the provider and the care manager must be complete partners. We can't do that in a building thousands of miles away from the provider if we're going to be effective. And then finally, our marketplace has allowed people to move the most sacred thing important to them, their banking, to their phone. Many of you daily will check your balance, will pay bills, all these things from your phone. Yet, we don't offer any level of care support in a routine way on the phone where people can interact. Last area of this, and then I want to share with you some thoughts. I lost my father-in-law to cancer three years ago, which is part of the reason I started this company. He was the Chief Information Officer of Hospital Corporation of America. He was financially well off. He knew the healthcare system extremely well. But his last 18 months were horrific from a care management point of view. Something we did as a family that really caught my eye for an opportunity for innovation is every time he would see the oncologist, we would all call one another because one of us would go with him. The minute you leave the oncologist's office, you're dialing every child, a spouse, a cousin, how is he, what's the news, and you tell the same story about 15 times. And every time he changed providers, we started over. Because I liked technology and I was around the Entrepreneur Center, I had some young programmers around, I asked them to create me a poor man's version of a family app where we could all share this care experience with my father-in-law. And we created a family network where every time something happened, we all just knew. One of his sons lived away in California. A daughter lived in Florida. Them having the opportunity to participate made an enormous difference in the family unit. But most of all, the minute we started doing that and we were all informed, his total cost of care began to plummet. Why? Because we were no longer racing to the emergency room in the middle of the night every time we were afraid of something. We dialed in his nurses and physicians onto the app. Everyone started participating. And from that journey, one of the things I learned very importantly is that if I can connect the family unit into a care management model, I can plummet healthcare costs. Because most of the things that drive us to seek medical care after hours is fear. And fear can be obliterated with the right tools. So let's think about what innovation might mean to this space. First is let's frame the problem correctly. People want access. Many of you are the networker for people you know because you're in the healthcare industry. That means if somebody needs something, they often will call you and say, who do you recommend? If you have a physician or nurse in the family, they will tell you they get that request about once a week from folks. Everybody wants access. It's no longer okay that access is an 800 number away. Access needs to be right in your pocket because every person I know has this cell phone no more than 2 to 3 feet away from their body all the time. So let's put it all here. Secondly, as there is a disproportionate concentration of cost in the top 1 to 5%. Now, I've spent my life researching this. My doctoral work was done in this area in cancer and neonates, studying cost. The top 1% of the population is responsible for about a third, not 1% of the whole insured, 1% of the claimants. 5% of the claimants is up to 65% of the cost, and by the time you get to 10%, you're covering about 80 to 85% of all cost. We can focus care management to the top 5% of claimants and have about a 20% delta change if we do it right. But we can't cold call 8 to 5, Monday to Friday, and expect it's going to work any longer. That model is dead. Advanced illness is growing very fast in our society, and it starts showing up really early. Cancer is a chronic disease now, where people will go through 6, 7, 8 rounds of treatment. If you happen to look at pharma costs, you will know that the top 3 drugs in cancer are now about $100,000 a round. Wow. At what point does this become unsustainable? Many of these are coexisting with experimental drugs that causes people to go to the ER because they don't even know the symptoms that they're about to have. Any individual with advanced illness needs care support in a big way, particularly because they're seeing a fragmented system. Anyone in a cancer or cardiac or neurodiagnosis will see an average of 8 to 10 different physicians or providers in a 12-month period. They'll, on average, go to the emergency room 6 to 9 times, depending on which of those diagnoses they have. And most of them will tell you they are so sick, they would much prefer not to be in the ER. But if you call for help after 6 at night, you typically get, if you think this is emergency, go to the emergency room. That's the instruction. So let's look at how the law of disruption can change this. And I've been studying disruptive innovation for a very long time. I've actually built 3 companies around it in the space. I think, is this battery hanging with me? All right. The law of disruption says that technology is always changing, and you experience that in your own life. The minute you think you've got the latest phone, within 3 months, there's something new on the market. I think I own 4 different iPads because the first one, they told me the second one was better, and then the third one was going to be better, and then the fourth one was this really big one. And 3 of them are stacked over in the corner. None of them are more than 6 years old. So technology is always changing, but people change really slowly. So we never keep up with technology. Now, because of that, new things starts to happen in an industry, and that small players using a new technology bring something to the marketplace that will take the incumbents a while to figure out. I began doing care support in Nashville with one of our largest employers last year for this very reason. He had been using a very traditional case management firm for about 8 years, getting 0 result on the whole for it. We simply began putting mobile access to families in their pockets and being available 24 hours a day, 7 days a week. Within 90 days, we had begun to change his trend in healthcare for that simple 2-part innovation. Now, disruption happens at the industry's edge. It's sort of like the way termites attract to a log cabin. And if you're the owner of the cabin, you may not notice the damage right away. I don't think Tennessee Blue noticed me right away. My guess is this next year, once we have about 10 significant employers using our model, we'll get noticed. But by then, I've hopefully infested the log cabin with a very new disruption that can actually work. Disruptors bring new business models. They also leverage new technologies, but most of all, disruptors change the customer's expectation. When a family who has something serious has access 24/7 to an experienced person, 8 to 5 is no longer acceptable. When you can text message from your pocket in the middle of a meeting because you're worried about a family member and get a response from a nurse or physician without having to leave the meeting and to know your mom is okay, you'll never accept having to go call and wait in the queue for your 12 minutes again. So one of the things I love about being a disruptor is we do change what the customer expects. Now, innovation happens in 3 fronts. First is it has to be led by smart people. Individuals who really know the science and the art of what they do. And my guess is there are thousands of nurses and physicians out there who work in this space equally frustrated as me because they think, why are we using 30-year-old technology? It looks like we're playing Pong on this screen trying to care for someone. Second, you need processes so that you know what to escalate when, so that the right person gets the right support at the right time, because it's costly to do. And the third is you need a really smart technology. For instance, imagine this. From your phone, you're calling in for support, and because it's a unique set of telephony, the person on the other end who's going to answer the phone already knows your name. In fact, when they pick up the phone, the screen is already up in front with your last visit. So they know exactly what happened on the last visit, and they want to know what they can do for you by name now. Third, the minute you're done, you get a push out to your phone that updates your family on the latest status of what's going on. So if the daughter lives 2 states away, she immediately knows. That kind of technology is the here today, and it should be in what we're doing for employers every single day if we want to see impact. Pricewaterhouse last year did a survey of the Fortune 1000 and asked them what did they wish would change the most. And the number 1 on the list was, please somebody coordinate this mess. Navigate some of this, help me deal with the chaos that my employees experience when something really significant happens to them. Because everyone at the workplace knows when somebody has something really big. One of the most powerful things a company can do from a PR point of view is actually show they give a damn by having some real expert helping somebody in distress. Now, when you want to transform case management and care management into an experience, you have to think about these kinds of experience drivers. First, it has to be in context, meaning when I'm getting info from you, you already know what's wrong with me and what else I've tried. Second is it needs to go across any device I have. So whether I'm interacting with you on my phone, I'm picking up the phone, talking to you, I'm on a pad, I'm at a screen, it all works the same way. I want this highly personalized content coming to me. If I don't have diabetes, please don't spam me about diabetes. But if I do, talk to me about a 56-year-old male's diabetes, not everybody's diabetes, because I happen to be a 56-year-old male. That's what I care about. All that opportunity is sitting here for us. We simply have to eliminate this old style stuff and start doing this in smart ways, the way consumers want to digest health information and analytics. I have found when we give people information, they act. But they cannot act without good information. There are 7 key elements that should be part of your care management program. And it has to be built around this notion of innovation. Innovation, 3 key variables in the color here. First is, how will the consumer use this? Second is, what will be the technology that leads this for you? And the third is, what is the business model? Is this a subscription? Is this a per hour rate? Is this a PEPM? How does it fit at the ease of the employer around the disease that works in this new environment? Now, these 6 forces moving across are like headwinds. All these can shape the way it looks and blow it one direction or the other, so you have to think about it in a dynamic way. But folks, I will tell you, the fax, paper, the phone, and the Rolodex are not innovation. If you see those still being the hallmarks of case management at an organization, run as fast as you can. Innovation is social, so people can share information about their disease. The most visited site by people with real disease is Patients Like Me. Why is that? Because they want to talk to other people like them. My mother-in-law, after my father-in-law died, has become one of the biggest advisors on our network. Why? Because she watched her husband deal with melanoma, stage 4, through 3 traditional treatments and 3 clinical trials, and she can tell you in a nanosecond what she would do differently today. Because those last 2 clinical trials cost my father-in-law his quality of life. No physician will tell you that. It's awkward even for a nurse to tell you that. But if you can talk to a family who's lived through this, it changes everything. Because you just say, this is what it was for me. I'm working with a figure skater from the 80s today named Scott Hamilton. I don't know if you know Scott. He's overcome 2 rounds of cancer, and now it's back for the 3rd time. Scott is becoming a leader of conversations online at Narus to help other people with recurrent cancer understand what that means to a family, particularly when you have children at home, as he does, because he knows the odds of him surviving this 3rd round is very low. So it isn't just the medical costs we have to worry about. In fact, the psychologically mental health drain on families is profound. And his case is just like that. And his sharing what's going on in his family with others is powerful because people know what to expect. I have found in my 30-some years in healthcare, people want to know the news, good or bad. What is the most terrifying is the uncertainty. I can handle just about anything if you just tell me what's likely. But if I have no news, it's horrible. I watch cancer patients do this all the time, where you go in for your test, tell you, we'll call you in 3 days. What the hell? It's the 3 longest purgatory you will ever experience. But we do that to people in case management all the time. Let me see if I can get you an answer for that, and then it's 2 days later before you get a call back. Or you call in saying, I don't think this pain drug is working for me. Well, let me let your doctor know, and sometime tomorrow morning they'll call you back. Well, I hurt right now. How about we fix this now? Because if you can't, I'm going to end up at the ER tonight. Because after 5, when it gets really dark and I get really scared and this pain goes from a 6 to a 9, guess where the hell I'm going? There's no reason for people to be like that. We can get them answers now. We can get the script called in now. We just have to get into now gear instead of one day gear. So here's the things we need to do in a care management program. The first is we need to understand what a patient experience feels like. Patient experiences are everything. The experience I feel is the most powerful part of what goes on, because if I feel I know what's going on, I can face anything. The second is I need help with the hard stuff. There are 7 key soft drivers of cost, none of them clinical. It has to do with, do I live alone or with a supportive family? How far away from the nearest medical facility do I live? How well are my symptoms being managed right now? Those top 3 are 50% more predictive than your diagnosis of how much healthcare spend you will have. We need structured care plans because this data from patients is extremely valuable. I'm working with a large pharma on the West Coast here named Genentech, who is looking to get customer-reported data from any drug that their folks are using, because it's very powerful to know, how did that make you feel? What were the symptoms? What did you experience you didn't experience before? We can no longer do case management as narrative notes. We need secure, structured text fields that we can research. We need a scalable service design so it can be anywhere 24/7. It has to be the right resource at the right time, so it needs analytics to drive it. It has to be centered with that family nucleus so change happens, and it has to be part of a really high quality network, not just of doctors and nurses, but other patients, so I can share stories with them. Final food for thought as I finish. I interviewed about 150 families to start this company. I asked them, what do you wish you had? I've interviewed about that many physicians and nurses. What patients and families wanted most is they wanted their data on their phone. So when they went to the hospital or the doctor, everything was there and they could push it with a text or an email. Secondly is they wanted to be able to report their symptoms. Third is they wanted family messaging. And finally, they wanted to access their care team right from their phone. Simple stuff. Things you can do with almost any other kind of app that you should do in healthcare. So we built a data collection tool for care management. If you're interested, drop me a note. I'll ship you lots of screens, give you something to consider and look at. The second is we built a mobile that would allow people to report their symptoms, have a secure login. All their data is right there on the phone. All their medications are there, and actually interactions, so they know what might be a negative interaction, or will this over-the-counter medication for nausea interfere with my cancer drug. Monitoring my symptoms, so I can push a symptom and get somebody pushing on it right now. A secure text message so families can interact, and access to my care team immediately. Really simple things that people want, but all those are highly disruptive to the process. So my closing statement to you is that there are two big pieces of healthcare costs. One is the unit price. You get that through an access to a network and discounts, all kinds of things, reference-based pricing, whatever it may be. The second is how many units do you use? And if you happen to be in the top 5% of claimants that are really sick, you're going to use multiple units if somebody is not your care coach. I suggest we all get busy thinking about how to do that. Thank you.